Two of the apps that help Aphasics to retrain in building their sentences. Most aphasia patients, or stroke survivors as they are normally called, uh, have problem building complete sentences. It's too much of an effort mentally to put the grammar together. And there is also the physical aspect that it is too much effort to move their tongue and pronounce the words for that the length of time required to speak a full sentence. And the other thing is they have the problem of short-term memory and also working memory, which are very important for doing any task, even simple tasks like reading the text or speaking a full sentence, um, or even concentrating for any length of time. All of these require working memory and short-term memory, all of which are very much affected after a stroke. The therapy has to be comprehensive to rebuild everything after a stroke. A person is a total wreck. Practically nothing functions. Most often, the right hand becomes dysfunctional. The right leg also becomes partially dysfunctional. They have to be retrained after many months and years of physiotherapy sometimes. That is the physical aspect of it, that the right side does not work, does not function properly. And because of all this, most of the stroke survivors go through a phase of even bladder control, because bladder control is one thing that always gets affected whenever there is any such severe shock event or any such severe disability event. Bladder control becomes one of the first things that goes haywire. So all those things are there, but we have to rebuild each thing separately. But when you put back the language into a person that has totally lost it, you can build up the person's self-confidence, because the ability to communicate with others is so essential for a human being. So when we build up the language, when we put back the language, that is like a big positive thing for building up the whole person again, the personality, their self-confidence, and every other problem that they have, mental problems. Putting back the language could cause a whole lot of improvement with even the other physical defects. It is possible that after improvement, significant improvement in speech and communication, they would be having sufficient self-confidence to build the other dysfunctionalities that they have, such as their ability, the bladder control, their walking, everything. Although there is no guarantee that they ever regain the functionality of the right hand, which is a very complex thing, and it is one of the things very hard to regain, and it is the last thing that ever gets corrected. In fact, I got two apps here, TFE Grid Words and TFE Sentence Maker, pretty much the same thing. TFE Grid Words was the earlier version.
It is a beautiful house. Correct. Click next. How do you do? Correct. Click next.
That is TFE grid words. That was the earlier version of TFE sentence maker. This is a more comprehensive application. No. You have two things here. One is rebuild. So, for instance, something that's a sentence that is jumbled up. If it is a simple sentence, the patients would be able to straight away start rebuilding it. But if it's a complex sentence, they're going to have a lot of difficulty. One way to retrain is first rebuild.
I would love to go for a walk.
That shows them what the sentence is. Then again, rearrange. The same thing gets jumbled up. So they still haven't got it. Go back and rebuild.
I would love to go for a walk.
And then rearrange.